Welcome to this focused overview of radiologic coding for the mandible. In this video, we'll cover the relevant CPT codes, common diagnostic views, and review a sample radiology report for documentation and coding accuracy. For mandible radiographic examinations, two primary CPT codes are used: 70100, radiologic examination of the mandible, partial, defined as fewer than 4 views. Use 70100 when 1 to 3 radiographic images are obtained. 70110, radiologic examination of the mandible, complete, defined as 4 or more views. Use 70110 when 4 or more images are taken to evaluate the mandibular structures comprehensively. Standard mandible radiographic series may include the following views: mandible AP view, mandible PA, mandible oblique lateral view, mandible infero-superior intraoral view, mandible vertico-submental view, AP axial view, Town method. Let's review a sample radiology report to illustrate the use of CPT code 70110. Exam requested mandible, 4 views. Views documented AP, Towns, and bilateral oblique. Clinical history, suspected lesion of the mandible. Comparison, none available. Findings: suboptimal evaluation of dentition due to overlapping structures, multiple missing teeth, amalgam restorations noted, periodontal lucency involving the most posterior remaining left lower molar, paranasal sinuses are aerated, impression, periapical lucency along the most posterior left lower molar, likely indicative of periodontal infection. This report supports CPT 70110 based on documentation of 4 views and thorough interpretation of bony and dental structures. ICD-10 coding strategy. Periapical radiolucencies are areas of dark appearance at the apex or root tip of a tooth, often identified on imaging modalities. While radiographically similar, these lucencies may represent a wide range of pathologies. It's a radiographic sign, not a diagnosis, and it can represent many conditions, from benign to infectious to neoplastic. Each of these conditions has distinct clinical and histological features but often appears similar on imaging, which is why accurate coding requires cautious interpretation. However, in most radiology reports, diagnosis is presumed, not confirmed, so we code conservatively using K0889, other specified disorders of teeth and supporting structures, or M278, other specified diseases of the jaws. These codes accurately reflect a radiographic finding without overstepping clinical boundaries. Unless the referring provider has confirmed the underlying pathology, radiologists and coders should default to general dental or jaw disorder codes. That way you remain compliant, accurate, and aligned with documentation best practices. Always pair your radiographic findings with the clinical history and ordering physician's notes when assigning diagnosis codes. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.